The United States health insurance system operates as a uniquely fragmented and multi-layered mixed economy model that differentiates itself from the centralized single-payer systems found in most other developed nations by combining private market competition with targeted public social safety nets, a structure that traces its primary origins back to the post-World War II era when federal wage freezes encouraged employers to offer health benefits as a tax-exempt recruitment incentive, thereby cementing the employer-sponsored insurance, or ESI model, as the bedrock of American coverage, which today accounts for nearly half of the total population's insurance. Within this private sector, the landscape is defined by managed care organizations that utilize complex provider networks to control costs, forcing consumers to choose between various plan structures, such as health maintenance organizations, or HMOs, which require a primary care physician's gatekeeping and offer no out-of-network coverage, and preferred provider organizations, or PPOs, which grant greater autonomy to see specialists at a higher premium cost, all while navigating a financial vocabulary of premiums, deductibles, the initial out-of-pocket threshold, and co-insurance percentages that dictate the share of a hospital bill a patient must pay even after their insurance kicks in. Complementing this private infrastructure are the massive federal and state programs born from the 1965 Social Security Amendments, Medicare, which provides a universal-style entitlement for citizens aged 65 and older and certain younger people with disabilities through its distinct parts, A for hospitals, B for medical, and D for drugs, and Medicaid, a means-tested program jointly funded by federal and state governments that serves as the primary payer for long-term care and coverage for low-income families, though its eligibility rules fluctuate wildly from state to state due to the Medicaid expansion provisions of the landmark 2010 Affordable Care Act, or Obamacare. The ACA, or Obamacare, fundamentally reshaped the system by introducing the health insurance marketplace for the self-employed, mandating that insurers cover essential health benefits and, most crucially, prohibiting the denial of coverage based on pre-existing conditions, a move that shifted the industry away from medical underwriting toward a more inclusive, albeit more expensive, risk pooling strategy. Despite these protections, the system remains a frequent subject of intense political debate due to its high administrative overhead, the decoupling of dental and vision care into separate secondary markets, and the persistent challenge of underinsurance, where even those with active policies may face medical bankruptcy because of high